Good afternoon, dear colleagues. I'm Жебрак Елизавета Владимировна, the fifth-year student of Приволжского Medical University. And today I'd like to tell you about sexually transmitted infections and their impact on reproductive function. Sexually transmitted infections, STIs, are infections which occur as a result of the transmission of pathogenic organisms by sexual contact, are generally acquired via vaginal, anal, or oral sexual contact. More 1 million cases of STIs are reported worldwide every day. There are 30 infections which can be transmitted this way. But nowadays, the most common infections are human immunodeficiency virus, gonorrhea, chlamydia, genital herpes, human papillomavirus, trichomoniasis, and syphilis. And today I would like to tell you about these infections and their consequences in more details. First of all, HPV should be mentioned as it's the most common STI worldwide. During the lifetime, most sexually active people are exposed to it. Therefore, persistent infections with high risk HPV types as responsible for 99.7% of cervical squamous cell cancer. It's also important to know that the manifestation of the human papillomavirus are warts. Secondly, we should mention genital herpes, which is caused by herpes simplex virus type 1 or type 2. Previously, herpes type 1 was considered to be oral and type 1 to be urogenital, but due to the changes in the sexual life of the population, both types are found in both areas of the body. One of the most serious consequences of HSV infection is pregnant woman is neonatal herpes, which occurs when newborns become infected with HSV during vaginal delivery. In such situation, the issue of the either delivery by cesarean section or immediate therapy of the newborns should be resolved. The next infection in one of the periods of history was called the French disease and led to death of famous people such as Oscar Wilde, Vincent van Gogh, Franz Schubert, etc. Syphilis caused by spirochete Treponema pallidum, subspecies pallidum. Syphilis is in pregnant is the second leading cause of stillbirth globally and has been associated with low birth weight, neonatal infections, and premature birth. Despite these facts, syphilis is a well-treatable disease, so timely therapy can limit consequences of infection. Also, one of the common disease is chlamydia, which gram-negative obligate non-motile intracellular bacteria known as Chlamydia trichomoniasis. Chlamydia trachomatis infection can result in reproductive damage, and if untreated, can be associated with inflammatory pelvic disease, ectopic pregnancy, chronic pelvic pain, and tubal infertility, increased risk of preterm birth. An equal socially significant disease is gonorrhea, which is caused by necessary gonorrhea. This infection can lead to pelvic inflammatory disease, tubal infertility, ectopic pregnancy, and disseminated gonococcal infection. Gonorrhea infection may also be associated with the adverse birth outcome, preterm birth, low birth weight, and premature rupture of membranes. Next one, trichomoniasis, is caused by Trichomonas vaginalis. This is the parasitic protozoan, pelvic inflammatory disease caused by vaginal Trichomonas infections, which are the cause of tubal infertility and chronic abdominal pain syndrome, are described mainly in HIV-positive women. The conducted studies indicate an increased risk of premature birth, the birth of the low-weight baby in women infected with vaginal trichomonas. The most important in this situation, STI prevention. First of all, we need to use correct and consistent condoms. Period contraception should be used for all types of sexual contact, vaginal, anal, or oral. Timely vaccination against hepatitis B and HPV virus. Renewal of timely medical examination. Also, exclusion of sexual contact during your treatment and treatment of your partner. Pregravital preparation. This is a complex of diagnosis, therapeutic, and preventive measures aimed at preparing couple for successful conception, normal pregnancy, and the birth of the healthy child. Volunteer medical male circumcision is also really important. Sex education classes at school. STIs pose behavioral, social, economic, structural, and political challenges. That's why we should pay attention to high-risk groups and educate among them. Furthermore, the price of the hepatitis B and HPV vaccines should be reduced, and STI tests and berry contraception should be made available. Only through multifaceted public health approaches will the STI epidemic be addressed and the reproductive health of the nation be ensured. Thank you for your attention.